Hospital stays, whether short term or long term, can cause stress and anxiety for seniors or any family members. While the entire family is eager for your loved one to return home and recover and resume their normal routine, many do not anticipate the difficulties that can come with transitions between care settings. Today, we're going to be talking about hospital discharges and the transitions that you go through from hospital to home and preventing hospital readmissions.
Affinity Home Care. Welcome to our family.
Hello. Wanted to talk about today about an important topic that a lot of family members have stress and they don't prepare ahead of time. And these are things that are really important to do when you are dealing with your seniors or your parents, either whether you're a home care company or you're a family member out there taking care of your loved one. And it's something that we don't really think about all the time. And when they have to be able to plan, it just becomes a lot of stress. And so you don't have to go through that if you prepare way ahead of time. The complications that can arise from transitions of leaving from the hospital, are multifaceted and can really contribute what has come to be known as the revolving door of hospital readmissions. According to the research conducted by the CMS, nearly 1 in 5 Medicare patients discharged from a hospital, approximately 2.6 million seniors is readmitted within 30 days. Wow. That number is huge. At cost, according to CMS, says that more than $26 billion every year. Now, looking past the financial impact of the hospitalization often takes a serious physical and mental toll on your parents and the elderly community, even though they're admitted to technically going to the hospital to improve themselves, their health, right? But there's many readmissions that are preventable and can be avoided with the addition of increased patient and family care education, improving your communication, having better discharge planning is what we're talking about right now, and proper post-hospitalization care. Hospitals, CMS, and also the U.S. Department of Health are working always constantly to reduce the rehospitalization rates. Home care companies they partner up with, but seniors and their caregivers can take many steps to make sure that to reduce these type of readmissions for the hospital system. Okay, professional in-home care can play a huge part in the roles of these transitions between care settings. And so hear me out now. The benefits of hiring post-hospital in-home care. Okay. Each person that's admitted to the hospital has a specific need, as we know, right? Following, it could be a surgery or a hospital stay, but in-home care offers several different core services that can facilitate the recovery process, improve your quality of life, and ensure compliance with these discharge instructions that are given. Now, this added support can alleviate the type of pressure that you're going to go through, and the family caregivers, I call them, family members that are going through this. Now, better communication and care coordination is something that you have to establish. Clear communication is going to be crucial for coordinating care among multiple healthcare providers that are going to be involved across different type of settings as well too. With regular communication, and not having it, there's no way of ensuring that your parents are going to get the care they need, both in the hospital and after they discharge and go back home. Okay. It's very important for you to understand that to ask specific type of questions and request explanations of terms and concepts that are unfamiliar. You need to understand all the conditions, the treatments, and the post-discharge instructions that they're going to be given. You having this information the day before they leave, this is what causes the stress. Hiring a professional caregiver or home care company that brings in a nurse or a therapist, and early on and setting that up has even been before the discharge happens. Okay, just adds an extra layer of you being prepared, right? Professional caregivers can be valuable when it comes down to your loved one's health issues, and ensuring that to make sure that what is prescribed is following the treatment, right? And determining what type of services you need and the assistance that you need, and making sure the home environment's right. Keep in mind the importance of discharge planning, what you're going to go through when you yourself or your loved one is leaving the hospital or the rehab. You can't wait. Okay. It's better to prepare ahead of time. Set yourself up with home care, healthcare professionals way ahead of time. While many patients are understandably really eager, okay, to leave the hospital and return home, rushing through this process can increase the risk of missing important points that you need, okay, during this time. Now, medications is one little piece of the puzzle. Okay, they're often changed or added to a senior's regimen or your regimen following a hospital stay. And a home health aide can make sure that these modifications are adhered when you go back home. Medication reminders are huge, and this is something that will cause the hospital readmission if you're not following the instructions. In-home caregivers and nurses and therapists can pick up a senior's prescriptions from the pharmacy, provide medication reminders, and keep an eye out of the new and also the worsening side effects that could happen. Okay. The same goes for the discharge orders for someone that's, bed rest. Getting up to walk is going to be a difficult task to be able to go and get their medications, and performing different type of exercises and stretches is going to be all difficult for them for yourself or for your parents when they come back home. What's your game plan? That's what I'm asking you. Are you going to wait to the last minute to prepare all of this? Follow-up appointments with your primary care doctor and specialists are another key point of the post after you leave the hospital. A professional care aide can help schedule these type of appointments and help you get there and take the notes, provide the transportation from the different type of visits. In-home care providers will incorporate all of these type of directives into a personalized care plan that they will create this will be followed by the patient, the family members, everyone that's involved. The nurses and the therapists and their care plans that they have all come together, and it creates this type of health organization to reduce a hospital readmission, to keep the person with integrated wellness all around, to make sure that we create this master game plan to make sure to keep them accountable for their health and the things that they got going on, that they are limited at this point in time. Research has shown over time that hospitalization is associated with declines of functional abilities, and seniors often return to their homes with unmet needs. Okay, it's true. I see it all the time that they come back home and the needs that they could have prepared for, especially when it comes down to medical supplies and assisted devices, and it was not ordered in time. all the instrumental activities of daily living that you have to organize, whether their personal care and their hygiene and their instrumental IADLs, which is making sure that their laundry is done and their cooking is done, and their if they're a fall risk, and making sure that their hygiene is in order, and grooming. All this, if it's not prepared for, can increase the risk of a hospital readmission. Supervision and companionship is also another piece of the puzzle that we're going to talk about. A smooth hospital transition requires multiple precautions and steps. Hiring an experienced home care company that can monitor and supervise you and your loved one, and can prevent complications, detect the different type of changes in physical and mental health, and decrease the risk of this hospitalization. This adds the number one thing that's really important is it's going to give you peace of mind that's undeniable. And this is the perk for family members, making sure that their loved one is safe in their home. Additionally, home care aides and home care professionals cultivate these meaningful relationships. It's a bond that they start to create with your loved one, different than obviously the son and the daughter, but loneliness and lack of type of engagement are detrimental for your parents, and it hurts their physical and their mental health as well too, especially in the wake of a medical setback. This is something that causes depression because of the limitations and the loss of independence that they're going through at this time. Patients may not be able to return, clients, your parents may not be returned to their home and be able to do their normal routines ever again, following a hospital stay. But professional home care care professionals provide the valuable social interaction and are skilled at the creating the activities that meet your parents' abilities and the different type of preferences and expectations that you want to uphold for them as well too. Even if home care services are only hired for a short period of time when they come in after a hospital stay, trust me, this experience can come handy down the road, and it's good for them to get used to having, professionals come in, and it's considered more of a necessity for their long-term care and long-term home care trust for them to have. Hiring a home care company after the hospital stay, home care agencies usually typically fill in the gaps between the hospital to home transitions. For either, it could be, like I said, it could be short-term or it could be a long-term periods of time, and depending on what your needs are. But they may be some type of initial anxiety for your parents when hiring a stranger that comes into your home after this traumatic experience that they had, and they might just want to be left alone. They don't want anybody coming. They're in the hospital, and people are coming in and out all the time, So depending on the level of care that's going to be required for, your parents, medically necessary home health care may be ordered, and it's going to be ordered by a physician or the discharge planner or the case manager, whoever is going to be the person. You will know, because they're going to be talking to you about what's the next stages when they come home. If it is not home health care, it could be non-medical home care services. Okay. And so, home health care services needs a prescription by a physician. Non-medical home care, which is called caregiving services, does not. You need to meet with both professional companies and talk to them and make sure that they can set that up. Typically, a home health care company does not need to come out to the hospital and set up the care. They send it all over to the home health care company, so the nurse and the therapist can come out and do an evaluation. You just have to hook yourself up with the right company. But when it comes down to non-medical home caregiving services, you can't wait before they come home. You need to have someone to come out and evaluate the home and check out the home environment, set up the care plan, start with working on staffing, and then when they come home, you'll be able to start care, and the caregiving company knows exactly what the daily routine needs to be, and also setting up the home environment to make sure that the caregiver is successful and your parent as well too. So once you determine the type of kind of care your loved one requires, you go through that type of selection, right? And the interviewing process of finding the right company that's out there, and caregivers too, as well. You have to interview them, make sure that you're comfortable with them as well too. Or usually it's the first day of care. You're going to meet the caregiver, make sure you have that bonding, good relationship and trust as well too, of the type of skills that they're going to provide. Delays in your post-hospital care can increase the likelihood of a readmission. It is a fact. It's been like this for a long time. And that's why home care companies work with hospitals when it's time to go home. So it's important to start your research in a very timely fashion. I couldn't stress this anymore. And I hope this resonated with you. If you have any questions or concerns, or you're in the hospital, or you have a surgery coming up, or you have a loved one already in the rehab right now, coming home, contact me. Let's talk it out. Let's figure out what the best steps are going to be for you to make sure that you have a successful post-hospital care for yourself.